In urothelial carcinoma, at this year's ASCO GU 2024 meeting, had one main abstract presented, and this is the Ambassador study. The Ambassador study is an academic trial from the US Alliance Group, and it investigated the use of pembrolizumab as adjuvant treatment after radical cystectomy for muscle-invasive urothelial carcinoma. The patients included were very similar to the other two trials that have been reported before, the IMvigor010 with atezolizumab and the Checkmate 274 with nivolumab. So these were patients that had either received neoadjuvant chemotherapy and then remained with postoperative muscle-invasive disease, so a YPT2 at least, or patients without prior neoadjuvant cisplatin-based chemotherapy and a histological stage of at least PT3 or positive lymph nodes. And in this patient group, the trial investigated the use of 1 year of pembrolizumab compared to observation, so no placebo was given, and the primary endpoint was disease-free survival. This endpoint was clearly met with significantly improved disease-free survival when using pembrolizumab for 1 year in this high-risk patient group of muscle-invasive urothelial carcinoma. The benefit for DFS was irrespective of the PD-L1 status, which is slightly different to the Checkmate 274 study using nivolumab. However, again, the overall survival is immature at the time, and no overall survival benefit was shown. In fact, so the Ambassador study confirms the results that were shown with Checkmate 274 using nivolumab as an adjuvant treatment. And in Switzerland, nivolumab is approved for PD-L1 positive patients, and it needs to be seen how pembrolizumab can be introduced in this treatment setting. Another report was the updated results from EV302 study. Everybody will probably remember that EV302 tested enfortumab plus pembrolizumab in first-line metastatic urothelial carcinoma compared to the standard of platinum plus gemcitabine, demonstrating a very high and significant overall survival benefit. And here, subgroup analyses were shown that this benefit is irrespective of prior treatment, whether this is or of treatment comparison to either cisplatin or carboplatin. So EV Pembro is always in a similar way better, nor was it dependent on PD-L1 expression. And also patients with liver metastases or lung metastases or lymph node metastases, they all benefit the same compared to the chemotherapy. So this just states once again that the EV Pembro is the new standard for metastatic urothelial carcinoma, also for different subgroups that were analyzed. But we are still waiting for some further analysis of the management of EV Pembro, especially when it comes to dose adaptation or adaptation of the schedule based on the side effect profile. And so I hope that such results will be shown at the ASCO annual meeting.